Hi everyone, this is Neil Ryder, consultant, audiologist and director of ClearWax. Thank you for joining me in my latest video using the WAXscope, and I really enjoyed performing this procedure because it's quite technically challenging. It may not appear so upon first appearance, but this wax is extremely dry, hardened and impacted right up against the patient's eardrum, and they've got quite a prominent inferior and anterior recess. I'll explain those terms during the course of the video. And the reason why this wax is so impacted is because they wear sleep plugs at night, bless them. They inform me that their partner snores incredibly loud, and without wearing them, they wouldn't get a wink of sleep. So there we are. Unfortunately, if you're someone who does suffer from excessive wax impaction and you wear sleep plugs or swim plugs or even hearing aids for that matter, you does run the risk of really pushing this in. Now, they have come previously, and on their previous occasion, I did recommend that they use some medical grade olive oil spray on a regular basis just to help soften this wax to make it easier to remove. But unfortunately, they haven't on this occasion, and therefore this wax has become really dry and it's solidified. And when you've got wax of this consistency, and when there's a flat surface like there is in the center here, when you apply the suction tip onto the surface of the wax, because it's difficult to obtain a suction grip, you run the risk of pushing this up against the eardrum even more, so it can be quite uncomfortable for patients when wax is this deep and impacted. Now, of course, if the wax was soft, it will come away in pieces. So I immediately put some medical grade olive oil spray, but ideally this patient would benefit from using it for several days, on a couple of occasions for several days beforehand. Now, when I did apply the suction tip, although it wasn't suctioning it outwards laterally towards the entrance, it did slide against the eardrum and ear canal, and the olive oil helped with that, which means that I have got something to grip onto here. Now you can see I'm lifting this wax and skin from the base of the ear canal, and where it's sitting in the ear is a region called the inferior recess. So that piece of flesh you can just see before the wax, just below the suction tip now. That's the second isthmus in the ear. So an isthmus is a narrowing. It's not only used in medical terminology, it's used in other walks of life as well. So beyond that piece of flesh, the ear canal actually dips, and that's where I'm retrieving this wax and dead skin out of. I'm trying to lift it out of the inferior recess. However, this wax plug is also trapped in the anterior recess. So similarly to that dip in the ear canal as we approach the eardrum, on the right hand side, so this is the patient's right ear, the ear canal widens to the right in this same region. Now, because I did lift some of that skin up, there was something for me to grab onto there. So I was hoping that with the forceps that I would be able to grab that and pull this out in one piece. However, it just teared away that section at the bottom, and probably it's made it a bit more tricky to remove now because the wax behind that and the skin is even more dry and crusted, so I'm just not getting a suction grip. Because this is in the anterior and inferior recess, it's very difficult to get a hook or the ear pick in here, or even the correct for that matter, because we're so close to the eardrum and we're going to be pushing right up against the eardrum. It'd be really uncomfortable. So I'm just trying to maneuver this. I think I do reach out for the correct, because on the right hand side that slither of wax has moved slightly away, but as soon as I approached it, I came back out because I just knew I'm not going to get it inside the anterior recess, and in fact I'm running the risk of pushing it back in. And if it was a bit softer, I was maybe able to lift that away. I think I'm going to use the correct again at the bottom just to see if I can wedge this out from the floor of the ear canal. And here it's a good view of the curvature of the correct. You can see it mimics the curvature of the ear canal. I'm trying to use the tip of the correct to get underneath this bit and lift up, but because the wax plug is compacted all the way around the edge of the ear canal, as I'm lifting it up, it's just pushing the top part of the wax up against the roof of the ear canal. There's no wriggle room at the moment. So I've just put some more drops in and trying to get a suction grip. Now, ironically, what really helped in this procedure is when I reverted from the standard 14 gauge suction probe. So the 14 gauge is the normal Zollner suction probe that you see a lot of us using, to a slightly smaller suction gauge size, the size 16, which is in between the Zollner that we normally use and the fine end that we also typically use, which is an 18 gauge. Now, although the 16 gauge has got a smaller internal diameter and therefore, on paper at least, less suction power, because it is smaller, it's easier to obtain an airtight seal with the suction tip. So with the 14 gauge, although it has got more suction power, but when you've got a flat surface like this, you're more likely to also get less of an airtight seal, which essentially means that the tip of the suction probe is not fully all the way around embedded on the earwax, which means there's a leakage there. And when you get leakage, you get some external air being suctioned in to the suction tip, which then decreases the overall suction power of removing the wax. So when you use a slightly smaller suction tip, now within reason, if you use the 18, it's just even if you do get a better airtight seal, it's just not going to be powerful enough to remove this. But with the 16 gauge, for example, because it's got a smaller tip diameter, I'm better able to get an airtight seal with it, and therefore the net effect, and that's the important phrase I think I should use, the net effect is that it actually generates more suction power. And this is what I'm using at the moment, I think, just to take this away. So you can see some of the eardrum now appearing. And what I'm trying to do is glide this from right to left against the anterior canal wall. And again, I'm just trying to get a decent suction grip. With the 14 gauge, I wouldn't be able to do that. So now, I think I'm going to go to the bottom here, but I think after that I'm going to go to the right hand side, the anterior canal wall. So I've got a good suction grip now, and I'm just trying to leverage this away out of both the anterior and inferior recess. But it's still lodged, and this is where I'm going to the anterior canal wall. There's some dead skin that I'm now able to peel away, and you can see that skin is materializing from the anterior recess where the ear canal widens. It's not fully visible yet. So essentially we're removing a large hardened piece of wax through a narrower portion of the ear canal, which is always challenging. Now, I could have resorted to the forceps to remove this, but by the time I swapped over, this is going to come away with the suction tip anyway. So I'm just continuing. And by removing this, although the ear is still blocked, but you were essentially decreasing the overall size of the wax and skin plug. And I've also managed to bring this out somewhat of the anterior recess. So again, I'm just going to the top now, and I almost roll it down. And I'm getting a better suction grip, so I think I have reverted back to the 14 gauge now. So I'm just stretching open the ear so we can see the top part of the hammer bone. That's now in view. But if you look to the right of the suction tip, you can see the wax disappearing to the right. So that's the anterior recess. So I'm now almost suctioning this right to left, and at the same time I'm coming forwards. I've just put some more oil, because we've maneuvered this wax plug around, some of the oil is now going to be able to enter in between the wax and the eardrum, just to lubricate it, if it is adhered, to help loosen that bond. And it's also going to help me get a slightly better suction grip. Now I did actually revert halfway through to the endoscope, but I came back to the WAXscope because I actually found it a bit more effective in this case. They both have their pros and cons. I think if you're really working up against the eardrum, like we are here, the WAXscope does help as you've got that magnification. At the same time, if you're working really, really close to the canal walls, or if you've got keratosis obturans, for example, or for me at least, if you've got a really narrow bendy ear canal, I'm actually more comfortable with opening and stretching an ear using the endoscope as opposed to when using a specular. The endoscope for me is better, but I'm finding real uses of both now. And at first, I would always resort to the endoscope, the iClearScope, for any complex case. But I'm now doing the reverse. I'm quite often, depending upon, as I said, the nature of the wax, the patient's ear anatomy is really, really important as well. One of the biggest difficulties that a lot of specialists found with the endoscope, and still do, is when you've got narrow, bendy ear canals. They find it difficult to dilate that with the endoscope. I actually find the opposite. I find it much, much easier stretching an ear open using an endoscope as opposed to the traditional method of using a specular. A specular is designed, an ear specular is designed to stretch and dilate and open an ear canal. But I find the reverse, and it's just because I've been using the endoscope for so many years. And also with the endoscope, there's no limit really of, in essence, how much you can, even if you can't totally dilate and straighten the ear canal, you can rotate the endoscope with little wrist movements and finger rolls to get the view that you want. With a specular, you are limited by just basically how flexible the cartilage and how bendy the ear canal is. So I've managed to remove that in the end. It's going to look, the patient's eardrum looks nice and healthy. So there's a hidden recess to the right and to the floor. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.